There's a reason people seem to smile more on sunny days. Beyond the warmth on your skin or the glow on your face, sunlight plays a powerful and underappreciated role in shaping mental health. It's not just about aesthetics or pleasant weather, it's deeply biological. The body and brain depend on light, especially natural light, to regulate hormones, synchronize internal clocks, and sustain emotional balance. When sunlight becomes scarce, as it often does in winter or in certain geographic regions, the effects ripple through mood, energy, and motivation. For many, this isn't just a mild case of the blues. It becomes a diagnosable condition, seasonal affective disorder, or SAD. At the heart of this sun-mood connection is serotonin, a neurotransmitter that helps regulate emotion, impulse control, and overall sense of well-being. Sunlight boosts serotonin levels by stimulating specific receptors in the retina that send signals to areas of the brain involved in emotional regulation. On bright days, this process hums along smoothly, contributing to feelings of contentment and alertness. But in the darker months, when daylight hours shrink and people spend more time indoors, serotonin production can drop, one of the suspected mechanisms behind the onset of seasonal depression. Then there's the role of circadian rhythm, the body's internal 24-hour clock that governs sleep-wake cycles, hormone secretion, digestion, and even mood stability. Natural light acts as the primary cue, or Zeitgeber, that keeps this rhythm aligned with the outside world. Morning light, in particular, helps reset the circadian system each day, telling the brain it's time to wake up, produce cortisol, and suppress melatonin. Without sufficient morning light exposure, the circadian rhythm can drift, leading to irregular sleep, fatigue, irritability, and increased risk of depression. In this way, light isn't just something we see, it's something we're wired to follow. For people with SAD, these systems go out of sync in a way that's both predictable and debilitating. Symptoms typically begin in late fall and can persist until spring. Low mood, difficulty concentrating, loss of interest in activities, increased sleep and appetite, particularly for carbohydrates, and a general sense of heaviness or emotional flatness. While genetics, lifestyle, and brain chemistry all play roles, lack of sunlight is the catalyst for the cascade. Treatments often center on restoring the light-mood connection, either through direct sunlight exposure, lifestyle adjustments, or artificial light therapy. Light therapy boxes, which mimic natural sunlight at specific intensities, usually around 10,000 lux, have become a standard treatment for SAD. When used in the morning for 20 to 30 minutes, they can help restore circadian rhythm alignment and boost serotonin levels, often improving symptoms within a few weeks. They work best when combined with daily routines that include time outdoors, physical activity, and intentional exposure to daylight. Even on cloudy days, outdoor light is far stronger than most indoor lighting. Interestingly, even in people without SAD, lack of natural light can still have subtle but measurable effects on mental health. Office workers in windowless environments, shift workers, or individuals who live at high latitudes often report higher rates of depression, anxiety, and sleep disturbances. Children who spend more time outdoors during the day not only have better mood regulation but may also experience improved cognitive performance and emotional resilience. In these cases, the sun doesn't cure anything directly, but it supports the systems that keep mental health intact. Sunlight's influence on mental well-being is a quiet force, powerful, invisible, and easily overlooked in an era of artificial lighting and indoor lifestyles. Yet evolution shaped the human body to respond to the rhythm of rising and setting sun. When that rhythm is disrupted or ignored, the consequences show up not only in energy levels but in the emotional undertow that pulls some people into winter depression. Fortunately, the fix is often as simple as a walk in the morning light or rearranging a daily routine to include a few sunlit moments. The light we need isn't just for seeing, it's for being. And when we follow the sun, even in small, consistent ways, the brain often follows with a brighter mood.